little over 20 years ago. I graduated from high school, so great to be back here for another momentous occasion. I do want to thank Deputy Director Leister, Dr. Branch, and the entire Department of Health team, as well as partners from across Baltimore County government, for their tireless work to get shots into as many arms as possible. Every day I receive emails from residents who have received a vaccine at one of our clinics, and without fail, they are so impressed with the efficiency of the service and grateful for the friendliness of our staff and volunteers alike. In fact, on my way in here today, I was stopped by two women who wanted to say how they were so pleased with their experience, and they couldn't believe that today was actually the first day of this clinic here at CCBC Essex. We have had hundreds of people working long hours to provide this critical service and to bring this pandemic to an end. And the fact that they continue to do so with smiles on their faces is inspiring. As of this morning, about 122,000 Baltimore County residents have received their first vaccine. Obviously, after today, that number will continue to rise. And nearly 44,000 of those have been administered by our health department. 8% of our residents, or more than 66,000, have now received their second dose. We continue to be a leader in the state for the number of residents who have been vaccinated. This is real progress. We know it's not happening as fast as many would like. It is certainly not as fast as I would like. But we continue to efficiently disperse the limited supply of vaccines that we do receive, having been touted as both a statewide and even a national model. As I've said many times before, local government is at the end of the vaccine supply chain. We rely on both the federal and state government for our doses. And based on what we have been receiving from the state and on what we expect to receive over the next few weeks, we know it will take more time to meet the considerable demand. But we remain ready to do even more. That's why today we're here for the official opening of this clinic in Essex. It is our third vaccination site in Baltimore County in an effort to increase access to all parts of our county. Dr. Kurtenitis, thank you and your team at CCBC for being a collaborative partner in our effort to get everyone vaccinated. Today I'm also pleased to announce two additional efforts that will increase access for people. First, a lack of transportation should never be a barrier for someone to get vaccinated. So we're making sure it won't happen here in Baltimore County. We have started offering Uber rides to our vaccine clinics for residents who have no other transportation options available. Supported by CARES funding, residents who have no other way of getting can now call our 311 line, and they will be connected with county staff who can schedule a ride for that individual. Staff on site at our clinics can then assist in scheduling rides home after those individuals have received their vaccine dose. In addition, Baltimore County is beginning an effort to vaccinate another vulnerable population, residents unable to leave their homes. Those who have been certified as homebound by their physicians can indicate that status on Baltimore County's vaccination registry. They will then be contacted by health department officials to schedule a time to receive their vaccine. In the coming days, the health department and the fire department will be teaming up to send mobile units with a public health nurse and an EMT to those individuals' homes in order to administer vaccines. We are asking those residents who are homebound to please be patient. Thousands of individuals have already registered indicating that they are homebound, and it will take time to get to everyone. But all of these efforts share the same goal: vaccinating as many people as possible so that we can save lives and finally bring this pandemic to an end. But I want to remind everyone that while we see the light at the end of the tunnel, our fight is not yet over. Globally, we've seen cases dropping significantly over the last few weeks. That's been true here in Baltimore County as well. Our case rate per 100,000 residents is around 13, down from more than 40 near the beginning of the year. But in the last couple of days, case rates have stopped dropping and have begun to level off. We know that the actions each of us takes will determine whether or not we continue the positive progress. We all want to get our children back in school, and to be able to keep them there. We want to be able to go out without restrictions, to spend more time with our family and friends. We want things to return to normal. And I believe that can happen soon, but we are not there yet. People are still getting sick and people are still dying. Especially with the emergence of new variants, I urge everyone to remain vigilant so that we don't reverse the progress we've seen in recent weeks. Let's continue the good work we've been doing so that we can get through this together. If we continue wearing our masks, practicing social distancing, and getting vaccinated when we're able, we will be on a path to winning the fight against COVID-19. I will at this point turn things over to Deputy Director of Health Del Leister for a few updates before turning things over to Dr. Kurtenitis.
Good afternoon, and thank you, Mr. County Executive. The Health Department is proud to be part of this announcement today as we add another vaccination site to our existing community locations. The department will continue to explore locations that place us directly in the communities that we serve. We want no barriers to individuals wanting the vaccine. The one barrier we have no control over is the supply of vaccine, so we continue to request patience from everyone as we continue to push vaccine out as soon as we receive it, even though it is not nearly enough. However, another large site, like the Essex campus of the CCBC, where we are here now, will allow for rapid rollout when that vaccine is available. Having started my public health career as a public health nurse visiting homebound clients, it brings me full circle to the announcement made a few moments ago. We have not forgotten those individuals that are homebound and are unable to leave the home to receive a vaccine. The fire department and the health department have been working on plans to address this void. If you have already signed up on the county registry and have identified that you are homebound, we have your name. However, once again, we ask for patience. There are over 10,000 individuals on this list, so we will be screening residents as we are able to serve them. We also remind everyone to continue to wash your hands, wear your mask, and practice social distancing. CCBC is joining an incredible team in Baltimore County. The Health Department, the Fire Department, the Police Department, other county agencies, the National Guard, volunteers, and many others have been working tirelessly to address this pandemic and now this massive vaccination campaign. Hats off to everyone working here today, and we welcome CCBC to this response team. Dr. Kurtenitis.
Well, thank you very much. I'm Sandra Kurtenitis, the proud president of this community college, and what I want to say to you is we are the Community College of Baltimore County. Community is our first name, and when the county executive calls, we are right there to help in every way that we can. And being able to partner with the county and just watching the efficient setup and now watching the efficient flow of all of the people through this is just, you know, it warms my heart because our staff have been working with the county executive staff, with the health department staff, and now we can contribute a significant addition to the number of vaccinations available for Baltimore County people. Our motto always is, we have capacity and we can help. But what I'm grateful to the county executive for is because our college is open when so many others are not, we have staff and we have faculty who are working at all six of our sites, as a matter of fact, to serve the 3,700 students who are taking on-site classes. Many other students are remote. But for those, we need to be here and giving our folks a chance to get a vaccination because we are partnering with the county feels really good to us, really good to our faculty and staff who really feel that their effort is valued and supported. So when County Executive Olszewski says, please help us, we're right there because we know what we do is going to help him do what he has to do. And our first name, and I guess our last, will always be community. So with that, thank you very much.
Well said. Thank you, Dr. Kurtenitis. Any questions?
What's an update on the number of teachers that have been vaccinated in the county? You still that updated information?
I'll have Della and the health department follow up with the most recent numbers. I don't have that currently in front of me, but we're happy to get that to you. I believe we actually have a number of teachers who are at this clinic today.
As far as this site goes, you said there's going to be other sites. Where else are you looking to do that here in the county? Can you explain that a little bit?
Sure. I mean, at this point, as we've said before, just at our first site up at the Maryland State Fairgrounds, we can do upwards of 1,000 doses an hour. We're getting about 5,000 doses per week. So you layer in what we're doing there, the fact that we have a clinic in Randallstown on the west side, we now have this site in Essex on the east side. I think we're going to wait to see until we get additional doses. We're also, today we unveiled the homebound program that we'll be rolling out, so we're going into communities on top of that. Della, do you want to mention if there's any additional need at this point to be looking at other sites?
So we're going to constantly look at other sites because we recognize that people that have been in their homes since March are really not comfortable in a large mass vaccination site. So once we get the mass site set up, we will look at some smaller locations which will not have the throughput, but it might be more comfortable. And we want to get out into the communities even more for people that have transportation barriers or any type of other barriers. So we don't have them identified yet, but we continue to look for them.
And obviously, as we get additional doses and that ramps up, it will be a lot easier not only to support these mass vaccination sites, but also the other sites that Della mentioned. So.
There's been, this is my last question.
Sure.
There's been some discussion in the past 2 days about vaccine equity. Who's getting what? Do you believe in Baltimore County you're getting what you should be getting from the state at this point?
We know there are logistical challenges across the state and in the federal government in terms of supply, but let me be clear. Everyone is entitled to a vaccine regardless of where they live. Whether it's Baltimore City, Baltimore County, if you are a Marylander, you should be entitled to a vaccine. And I'm very proud of the work that Della and the health department is doing on vaccine equity in Baltimore County. We are very diligent about our own distribution efforts within the county, but we want to just make sure that everyone who wants a vaccine is able to get one and that it's done equitably for all communities. Yeah.
County Executive, the Randallstown, I understand, is open 1 day a week right now, just because the limit is low.
Yep.
It'll be the same here?
I believe that's right. Yep. So this will be, I believe, on Fridays, 1 day a week. And again, it's just a shortage of doses that are available. We're optimistic with what seems to be the pending approval of the Johnson & Johnson vaccine that we may see an additional amount of supply. The fact that it's a single dose vaccine can be a game changer. But we're ready. We have so much capacity. As the governor said when he toured our other mass vaccination site in Timonium last, these are like Ferraris. They just need gas. So we're ready for the gas. We're ready for the vaccines to get them out there.
And at this clinic, if you have 10,000 people on the list, I want to make sure I understand how it benefits people who live in this area. Is it zip code specific? Is it look at locality of the 10,000 on the list and try to draw them here instead of first come, first served? How do local people get guaranteed that they're getting in?
I'm going to pass it over to our health department expert here. Thanks, Jerry.
Okay. So when we get an allocation of vaccine, we spread it across all 3 sites, and then we take the master registry and we pull names down from that, and then that link for those sites is sent to that master list so that people do usually have an option. Sometimes we don't have a clinic because we don't have vaccine for that location, but we do give people that option that they can be served in their community, which is the other reason we're trying to explore some other settings.
Thank you.
Thank you.
Yeah. Let's watch you get this shot. Yeah. It'll be fun.
You're welcome.